Welcome back. Many people find that hair loss is an inevitable and annoying side effect of aging, but it doesn't have to be. There are several types of treatment options available, and Dr. Jennifer Trent from American Dermatology is here to explain them. Welcome. Great to have you with us.
Great to be here. Thank you.
What causes hair loss? It's like one of those things we all sort of have to cope with, male or female.
Yes, I ask myself a lot.
So do I.
It's a multifactorial problem, so lots of things are contributing. It's not just genetics. There's also stress is a huge one. Internal causes like hormones or poor nutrition, even external causes, UV from the sun, hair care practices, hair dyes, hair extensions.
Okay, so lots of things we do throughout our life then contribute to this. I have to tell you, the statistics that show the marked increase in age of hair loss is amazing. It's like by the time we get to 60 plus, everybody's going to have their hair fall out.
It seems that way. About 80 million Americans suffer from hair loss. By about age 40, about 40% of people will, and it jumps to 80% by the time they're 60.
And that is men and women, you said?
Yes, men and women.
Okay, and I know it's a little harder to notice with women just simply by the way we style, but it really is happening.
Unfortunately, yes.
Unfortunately.
I can attest to that personally, yes, it happens.
So this can have a huge psychological impact on people, so as a result, people want to find some options. Talk to us about some of the typical treatment options.
Well, there are 3 FDA-approved options. The problem with those is they can have a lot of side effects, and it does take up to 12 months to see some effects in these, like topical minoxidil, which men and women can use, oral finasteride, which men can use, and then low-level laser therapy, which both men and women can use.
All right, so somewhat not as effective as probably people would like, and then there's also, I know, some side effect concerns as well.
Right.
But you have found that there are some of the newer treatment options that are actually doing a really great job, and you brought Nutrafol to tell us about.
I did. Nutrafol I consider like hair fertilizer. It works really well for both men and women because it works from different aspects. It's not just treating one of the causes of hair loss. It's got ashwagandha in there, which is a funny sounding word, but it actually works against stress cortisol levels. It's got antioxidants like vitamin E, which will help repair a lot of the free radical damage we can get from pollution and UV. It's got curcumin, which is an anti-inflammatory. It's got saw palmetto, which will help inhibit DHT, which causes hair follicle shrinkage, plus things like collagen, amino acids, which really help rebuild the hair.
Okay, I'm going to ask the million-dollar male question and female question. Does this help grow hair, or does it simply stop further hair loss?
I have found personally that, yes, it does regrow hair. It makes it thicker, even a little bit silkier, I think.
Okay, good, because I know that that's always a thought when people are looking at treatment.
And you actually brought some images of the befores and afters from Nutrafol.
I
Because I always like to see, do they have the type of loss that I have?
Yeah, let's take a look at it. So tell us what we are looking at in terms of the success of Nutrafol.
Well, this gentleman used it for about 6 months, and you can see no more bald spot in the back.
Yeah.
Almost all filled in.
Okay, let's
Works
continue
really
to
well.
flip through these images and see what else. Ooh,
nice.
That's the one I associate with, the female side part.
Classic. Moving it in what we call the bitemporal area. So this regrew very nicely.
Absolutely.
Oh, wow.
Another gentleman who had some great results.
That looks really good.
Those temples are filling in nicely.
Yes.
Okay, so lots of different examples there of the fact that it isn't just retarding the falling off, it is also then, helping the regrowth.
Growing back,
Now, people have heard of something called PRP probably in general, but you offer something called PRF. Can you explain the differences and what those actually are?
Sure. They are very similar in that you'll extract a patient's blood and you'll spin it down until you get what we call the liquid gold level, which has all the platelets and the growth factors. That's kind of yellowish.
Okay.
And we'll extract that and we'll inject it into the areas on the scalp where we need to regrow hair. Okay. The differences between them is, and why I like PRF a little bit better, it's called platelet-rich fibrin. I use the Easy PRF system. It's 100% natural. There's no additives like you will have with PRP. There's fibrin in it, which acts as a glue to keep the growth factors and the stem cells in place where we inject them, where we need them most. And plus, it has more growth factors and stem cells in it than PRP.
And you have said that works very well in combination with the Nutrafol?
Yes, I like them in combo.
Oh, and in this case, I mean, it doesn't look like much because it keeps his hair short, but there's new growth there, which is what's amazing.
If you look in the posterior area where that mole is, you can see a lot of new hairs there. hair.
Right, okay. So it's sort of a combination method.
Oh, wow.
Yes,
That
because
makes
we
a
like to
difference.
treat
Look at that.
multifactorial problems from different angles to attack the different causes.
Right, which makes sense because the whole reason we start losing our hair anyway is multifactorial.
Yeah.
So
Exactly.
that works great. All right, well, it's good to know that there are treatments out there and that people we can ask about them, because I know it is obviously a common problem, but also an important one for many people.
Definitely.
So, all right, well, thank you for the new information. For any of your dermatology concerns, you can find Dr. Trent at AmericanDermatology.net. And for more information about Nutrafol for hair loss treatment, you can go to Nutrafol.com. Coming up next, we have a hint about where this week's field trip will take us. We'll be right back.